HealthWish is a series of conversations about the state of healthcare in New York City's fabulous fifth borough, Staten Island. Our goal is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone. Northwell Staten Island University Hospital is committed to supporting patients throughout their weight loss journey. Listen in as we learn more about how Dr. Ortiz Pujols and Dr. Esposito integrate behavioral health into their program to provide patients with the tools they need to succeed. Give it a listen.
One of the things I have heard from people that are getting evaluated for weight loss surgery is this idea that they're sending me to a psychiatrist because they think I'm crazy. And it really isn't about that, right? It's about this idea that we're going to support and make sure that you have the tools that you actually need to get the most out of this journey that you possibly can, and not just to screen you for X, Y, or Z. Am I right on this?
Correct, yeah. A lot of it has to do with your understanding of what's happening to you, what's happening to your body, the social structures you have in place at home to take care of your needs if that's necessary. It's a lot about support. This is something that everybody has to go to and should go through. I think it's really important for your overall health. That's part of everything. We don't just take, an organ and say we're going to fix this one thing. We want to fix all the organs all the time, and the brain is an organ.
We have been working very hard to try to integrate behavioral health more into our program to really make it as comprehensive as possible. It's also what is going on in the brain that is contributing, what is going on in your social structure. Many who we see are people who are kind of taking care of children, taking care of parents, and working a full-time job. How do you manage all of that stress? So this is not about looking for a pathology. This is how can we support you so that you can manage things and be successful and do what you want to do and have the success that you're looking for. A lot of that stress, anxiety, or depression manifests itself physically. So you have people who sometimes may undergo very expensive workups looking for something, and in reality what we didn't address was the stressors, the anxiety that would have been better served perhaps with speaking to a therapist. So having the safe space to have that conversation, potentially avoiding misdiagnoses or over-medicalization of an individual, submitting them to numerous tests, if we can just have them sit down, talk to someone where they're feeling safe, not judged, then it could be so good for their overall well-being as well as their families as well. It makes them better people.
We use the term obesity and BMI all the time. Can you give me a sense of what those things actually mean and maybe what some of the misnomers are with those names and phrases?
Obesity is a disease. It is not a choice. It is not because you don't have willpower. There are actual changes that are deeply inherent to insulin resistance, inflammation, changes in the brain structure that all contribute to the disease process of obesity. Now, obesity has traditionally been defined by BMI cutoffs, which BMI stands for body mass index, which is a very mathematical weight over height type of measurement, which does not tell you anything. Is it a man? Is it a woman? What's the fat distribution? What age is this person? What race or ethnic group is this individual? So it is an easy measure to use, so it's a good starting point. It is not the be-all, end-all, and we need to look at other things, and there's a lot of work that's going into waist circumference. So the fat around the waist, as that being the more dangerous place to accumulate weight and how it relates to increased risk for any number of conditions, 250 conditions and counting.
And I love the waist circumference thing because it's a conversation I have with my patients all the time. When we get to the 6-9 month post-operative period when patients have lost a considerable amount of weight, a lot of them are motivated to go to the gym and start working out, and I have to have the conversation when they come to my office and their weight loss is stalled. And I say, well, have you been doing more gyms? Like, oh, I'm going to the gym really regularly. I'm feeling a lot of tone. So the question I always ask them is how your pants fit. And they say, I can't keep up. I keep having to buy new pants. It's like, then do not look at the scale anymore. Muscle weighs more than fat. So the more you progress, your progression is about your waist circumference. That is the best marker that we have currently.
and also women who are going through perimenopause and menopause, right? Much of their weight gain is around the waist circumference, and their BMIs can be normal, but now they're starting to have increased sugar levels. They're starting to have increased risk for breast cancer, for heart disease. That is not fully being captured by the BMI, but it is being captured by the fact they're gaining their weight around the waist.
Someone decides that they want a surgical option, right? There are actually, in the modern age, really a couple of things you can do here, from robotic to laparoscopic to a lot of different possibilities. Can you give me a sense of what those options are?
Of course. So the general idea is that the more you do surgically, the more weight loss you typically will have, and you slightly increase your risk of complications the more things you're doing. The most common procedure performed in the United States today and performed at Staten Island University Hospital is the sleeve gastrectomy. A lot of people think the sleeve is we're putting a sleeve on top of your stomach. I wish they would have named it something else. Essentially what we're doing is we're cutting out a portion of your stomach and making it a lot smaller. It's a purely restrictive procedure, though the more modern data is telling us that there are actually a lot of hormone and endocrine changes that happen when you take out that portion of your stomach. But essentially, the easy way to understand it is we're restricting how much you're eating. Restrict how much you can eat, feel fuller faster, makes you lose weight. We want that to be done in a very controlled setting so we control what you do eat. But over the course of your postoperative path, you will get back to basically eating what you normally do. Some people find that there are some foods that they don't tolerate as well, but for the most part, you go back to what you're normally eating, just in smaller portions. Taking the next step further, something called a gastric bypass. I think most people have heard or at least have a general understanding of what's happening with that, though obviously the surgical process of it is a little bit more complicated. Essentially, we make a small pouch out of your stomach, so you still have restriction, but now we're changing the path of how your food works. So your food goes through a different pathway. It doesn't get absorbed as much by less of the intestines, essentially. We at Staten Island are also doing a procedure called the SADI, or the single anastomosis duodenal ileostomy with the sleeve, or SADS. SADI is a lot obviously easier to say. And that is a restricted procedure and a procedure that's bypassing intestines, but a little bit more intestines are bypassed and a single connection is made. More weight loss, a little bit higher chance of having nutritional deficiencies, but a really good option for patients who have a lot of weight to lose, essentially. So there's a little bit of something for everybody. The mantra that sometimes I have with patients is like, if there was one that was the safest and gave you the most weight loss, there wouldn't be others.
So I am sure there are cases that are not bread and butter or are not straightforward, where they're not even clearly medical or clearly surgical. What do you all do in that situation where maybe you want more people to weigh in because somebody's not clear cut?
Yeah, we come across that problem pretty regularly. In fact, every Wednesday we have a conference where Dr. Ortiz Pujols, myself, our two other bariatric surgeons, Dr. Haney and Dr. Angstead, our nurse practitioners, our dietitians, our coordinators, even our secretaries come, and we discuss complicated cases so we can all get a better idea of how we're going to manage this person the most effectively and how we can individualize that approach.
Tell me about what medical weight loss is like, and what are some of the other things that are actually involved in it, and it's really not just about one class of drugs.
Yeah, thank you for asking that question, because the GLP-1s have been extraordinary, revolutionary. However, there are a lot of practical matters. They're not well covered by insurance. Even when covered by insurance, there still can be several $100s. You have to be very mindful of what you're eating. There is muscle loss. There are significant stomach issues that can happen. People have ended up in the hospital because they have not been able to go to the bathroom, or they have terrible reflux thinking they have a heart attack. So we need to watch these medications, and they're just as many side effects as they are effective. And we constantly need to be evaluating it depending on how the person is changing as well.
So what you're essentially saying is, don't necessarily assume that you know what you need. Go to a medical professional who will give you what your options are, and you can make a more educated decision. How does one of these folks that are watching this today come see you all?
So you can make appointments online. You can always call the office at 718-226-1300.
256 Mason Ave is where the office is.
Yep.
and you can go on the SIUH website if you want more information about it, are the 3 best ways to reach you all.
Absolutely. So there's someone who will be there to help you.
Thank you all for being here, and thank you so much both for being here. This is really an amazing thing. It's a topic that I love talking about, and every time I speak to professionals like you, I feel like I learned something. So thank you both so much for being here.
Thank you for having us.
Yeah.
Thank you very much.
And to the amazing folks that have developed this beautiful gym and are actually running Retire Fit, I want to thank them all for letting us use this space. What better way to talk about obesity and how important fitness is towards obesity than to actually do it from a place that really can be one of the building blocks of helping people to a better lifestyle. We'd love to see you frequent all of our partners, but this is an amazing place. You should give it a try. I plan on it.
HealthWish wishes to thank our special guests, Dr. Ardolic, Dr. Shiara Ortiz Pujols, and Dr. Christopher Esposito. Recorded at Retire Fit. We're very interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.